Hi everyone! So our group did our project on fetal alcohol syndrome, which is also known as FAS. So in this picture, these are the physical features that are commonly associated with people that have fetal alcohol syndrome. So the most common out of all of these would be the thin upper lip, short nose, flat midface, and a smaller forehead. So the cause of fetal alcohol syndrome is when a mother drinks while she is pregnant. So alcohol travels from the bloodstream through the umbilical cord to the baby, which causes issues in development throughout the pregnancy. And then here again we list some of the indicators for fetal alcohol syndrome. So before we talked about physical features, but other features may be hyperactive behavior and even intellectual disabilities. So in the most severe cases, fetal alcohol syndrome can be diagnosed at birth. However, they are normally diagnosed between the ages of 8 months and 8 years old, but every child can present fetal alcohol syndrome differently. So when it comes to the diagnosis, there is certain criteria for diagnosing fetal alcohol syndrome. So first, you need to confirm that the fetus was definitely exposed to alcohol during the pregnancy, and then once that has been confirmed, you can examine the characteristics of the child and see if their characteristics match those of which are commonly associated with fetal alcohol syndrome. So here are a couple statistics regarding the prevalence of fetal alcohol syndrome in the United States. FAS affects around 40,000 babies each year, and then another statistic talked about how it's estimated that 2 out of every 1,000 babies are born with fetal alcohol syndrome. And the picture of the map represents alcohol consumption rates across the U.S. for women from ages 18 to 44. So something important to understand is that no safe level of drinking has been identified for pregnant women. So to eliminate the root cause of the problem of fetal alcohol syndrome, the answer would be to have absolutely no fetuses exposed to alcohol. So a primary prevention would be to educate the public at all levels about this issue, because some women may be drinking while they're pregnant and they have no idea. Or they may not know they're pregnant and be drinking, and that's another issue. So some secondary preventions that might be helpful would be to have screenings and even offer supportive counseling, which could reduce pregnant mothers' alcohol consumption by 60 to 80%, and it could even reduce heavy drinking by 35 to 50%. So once alcohol consumption has been identified, there are a couple steps that could be taken to do an intervention. Some of the intervention strategies would be to discuss the risks of drinking with the pregnant mother and the family. Another one would be to ask the mother why she's drinking and maybe provide some counseling. You could set goals with the mother that lead toward rehabilitation, and you could provide social support to enhance the quality of life for the mother and the baby. So there are a couple different types of assistive technologies for students that have fetal alcohol syndrome. Sometimes children with FAS have trouble paying attention and they get distracted easily, so computers can be a helpful learning tool that keep the student engaged. Another technique would be for the teacher to use visual cues combined with oral cues in the classroom. So an example of this would be to have the instructions listed on the overhead projector so the student can read them, but also have the teacher read the instructions aloud to the class so the students can visually see them but orally hear them also. And then a smaller tool that might be helpful would be to have timers or stopwatches so that the children with FAS can kind of stay on track and understand how much time they have left for assignments. So that is everything we have. Here are our references, and thank you for listening.